People who enter treatment for alcohol or drug dependence usually need several different stages in their treatment. For most people, the first stage would be called detoxification. That's a medical term that just refers to a medically supervised withdrawal from whatever substance they've been using. Some symptoms of withdrawal can be dangerous or even life-threatening. People who are really dependent on alcohol can have seizures and very serious medical consequences for stopping. So they need to have medical supervision while that occurs. Detoxification from alcohol or drugs usually takes several days, 3 or 4 days. And medical supervision or treatment is given for people who are dependent on alcohol, sedative drugs, and to a certain extent also heroin or oxycodone, which are called the opioids. Not that withdrawal from those substances is life-threatening, but it's extremely uncomfortable, and so it really requires some medical treatment. Once the person has been medically stabilized, then it really has to do with learning new strategies for living a life free from alcohol and drugs. And that kind of treatment includes individual counseling, family counseling, and group therapy. It may also involve educational or vocational rehabilitation. People who become drug dependent very often have disrupted lives. They may have dropped out of school, they may not have jobs, they may have legal problems, they may also have other medical problems. Some people who become drug dependent will also have hepatitis or HIV, even full-blown AIDS. All of those things need to be addressed as part of their drug treatment, and that takes weeks or months.
So treatment with adolescents usually has many components, a family therapy component as well as an individual therapy component, and sometimes groups with your peers, because all of those are such important aspects of an adolescent's life. Also, with adolescents, remember, most kids who come to addiction treatment or get in trouble with drugs and alcohol, they don't hit rock bottom and say, geez, I've just got to stop drugs. Many who come to treatment don't want to stop using because drugs help them cope with problems in their lives, but they haven't been at it long enough that they have all the sort of medical negative consequences that adults may have who've been using for years. So the approach has to be focused on meeting kids where they are, helping to enhance their motivation as they gain skills to fight the addiction, and then really heavily focused on what they would like to do and how they might use something besides drugs that is really rewarding to them. And so the treatment differs in that way, that we have to do a lot of skills building, teaching adolescents how to fight the effects of drugs or coping with craving or avoiding high-risk situations, finding friends who don't use drugs, those kinds of approaches, as well as working with the families so that the families can help them maintain their abstinence or help reduce their drug use.
So it's important to make sure that they have a good, consistent, aftercare plan, which includes going to groups, having some check-ins with those people that I talked about, and making sure that they're open and honest about what they're doing in their use. And that can be through 12-step meetings, could be groups at the school. Sometimes schools have groups where they pull the kids out one period a day to check in about their substance abuse. Those are great groups, because in the middle of school with all the temptations and other people maybe they ran with, they're able to have that brief check-in about, hey, I'm doing okay, I'm not going to use. And oftentimes kids have told me that just that one-time check-in during the week is what kept them sober. And so I think it's important to have that plan in place.
Success in treatment is different for every individual. It depends on what their personal motivation is. It looks at life environment, what their life and lifestyle is like, and those are some of the things that we look at when we're in treatment, is what's going on in their environment that can either help them or is hindering them from getting clean. And everyone's different. Everybody has a different personal bottom.